of CDC and a representative of UN and WHO, sorry, and Ministry of Health. How can you help us, we as students, because we came out as students with this initiative to prevent, to teach the society down there in the ghetto. I had the representative of there that we need resources. For us, we started with our resources, and we are getting updates from the Ministry of Health platforms. And we blend them and we spread them to our what? Our in society. Let me say. So we are doing it right now, and we are looking for how you can help us, how you can push us.
Thank you for using your own resources and getting started. We need to pick a leaf from you. Let's keep it brief and only one question or comment.
Oh yes, big thanks. Oh yeah, big thanks everyone. And thanks for this moderating. I'm sure you get upset when you're this is a great raise I wanted to make to you guys.
Kindly get the mic closer. We're not hearing you as well.
Oh, sorry. Yeah, I wanted to raise this to you. I'm sorry I have to raise it down here. A friend of mine, of course, posed to me a question which I wanted, of course, positive guide, but it was just like after me for my best. Yeah, he was saying that it was a vital complaint. The quick one here. As we have had this great opportunity, it's valid information from you guys. But then, what happens to our locals down there? Okay, somebody say the ghettos. By the way, people don't know what the meaning of the word ghetto. They don't know. But what I can tell you, the people down there, the locals, they know nothing about this. Actually, somebody says self-quarantine. We've had self-quarantine. But how do we self-quarantine ourselves? Are there handouts from the World Health Organization that can be shared for somebody to know? Because okay, it can be mentioned as a word as self-quarantine, but I don't know. Then about the masks, should I call them the face or the mouth masks? What should they be used? Within the gatherings? We don't know. People need to know all that. Then the locals down there, they need to get this vital information. But how do they get it?
Okay.
Of the community or the chairman or anybody concerned the authorities. Something
looks
done
like
about
we
this.
have a big link for the person down there.
Yes,
okay.
Lastly, working as a football coach at one footing, I'm in coordination with Youth Hub Uganda, trying, and already this is what we've been trying to work upon. So it just came along, and we really think that we can consider again. It all starts with you and I. So I think we can.
Okay, thank you. We'll take the 3 hands
so much.
there and probably close in on those. Please keep it just one, because you're taking time from the next person, and we will not be able to.
Thank you. This side, I am from the Uganda Tourism Association, and if you read the monitor of yes and all agencies, but where we want to put a question is the strategy in communication. Whereas this pandemic is with us, we believe that the strategy of communication has not been well managed. And as I speak today, instead of us communicating the preparedness, what is being communicated is the catastrophe of Corona. For us from the tourism industry, what we would think that should be hitting the headlines, it should be hitting the social media, is how Uganda is prepared to combat Corona. That means, what should the citizens do? What should the media houses do? What message should be sent out? But currently, the message that's sent out is catastrophic. It is showing the desperate situation of Uganda, and inwards, from the business perspective, it is causing us loss. Today, the Trade Ministry called a breakfast meeting, and Uganda, as it's estimated we have lost about $100 billion because of Corona. So meaning that we need to change our strategy of communication and copy from our colleagues. We send the good message. This is how we are prepared. So that the world out there doesn't see that we are already, without even any case, we're sending a disastrous message. Thank you. I think that is mainly what I would want to say, but I would end by commending the ministry, and I always think that we need to change the strategy of communication.
Thank you, thank you. It's good we've heard from tourism and the impact on your sector. We'll get a comment on that. Kindly write down your questions. We won't be able to take all of them. Well, the lady looked so devastated that we are closing in on her. Can we just take the last one from the lady? She's had her hand up all the time. Creating gender violence as well.
My name is Abdallah Ahmed. My question goes to the Dr. Jonas, the representative of WHO. He mentioned that, over 60,000 people have successfully recovered from coronavirus. So and you've mentioned, that there's no licensed vaccine for coronavirus. What have they used to recover from the coronavirus? Then a general question asking
Thank you. We are taking only one, please. Let's allow the lady to do the last one, and then we can close in the next 10 to 15 minutes. Thank you.
Thank you, moderator. Good evening, everybody, ladies and gentlemen. I'm Moka Twine. I'm from Kasita, Uganda. And we have tried to sensitize the traders, business community, more especially who have been going abroad for business, at least not to go for this coronavirus. Some of the flights have been cancelled. Airlines are no longer coming to some countries. Yesterday, if I had the president was alerting people who are coming to Uganda to stop. Now, my suggestion is, why do these foreigners who come from other countries, instead of being quarantined, because now we are facing a problem of the disease, but economically, it is also affecting us. Instead of spending on these foreigners who are coming, that freight that is coming, so we spend on our people and on our citizens.
Okay, so that's the last question we have, and I think we will take very quick. There's a question directed to the CDC director, the WHO country representative. There was another one for Ministry of Health, then we should wrap up.
I'll be very brief and others can answer. Thanks for the great questions. It's great to see so many young people in the audience, and some of you are already doing things. And I think, we live in the social media age where so much information is available already. But I think you've heard from other colleagues. Please use respected sources, WHO, CDC, Ministry of Health. We've all put out a lot of information, but we do need you to help translate it on the ground in ways that make sense in your communities. And I think that's where we can partner. If you'd like us to review things you're working on and that sort of thing, we'd be happy to do that. But I think there's plenty of information out there. Just make sure that you're using reliable sources. And we rely on you to get the message out.
Okay, I'll try to first of all answer the first question. There are close to 70,000 out of the 137,000 cases. 69,643 have recovered. One thing we have to remember is, just like flu, just like any other disease, our body fights. And it is important to ensure that our body gets the time to recover. That's where the supportive therapy comes. that is also reflects that out of the almost 140,000 cases we have globally, only 5,000 people died, because that's basically telling you not all people who get sick die, and that the body fights, and the most important is to make sure that we catch them early and we give them the supportive treatment to make them recover. Somebody asked the question, will it come? I hope it doesn't, but I would rather be prepared saying it will come, because what I am seeing in the last 8 weeks from one country to 123 countries makes me wonder that whether we will be able to be the only country which will not have it. So it's better to get prepared. It's not about resources. The most important communication is person to person. Let's transmit that message to everyone we know. In this, we are not asking so-and-so teach so-and-so, or so-and-so inform so-and-so. It is the duty of all of us. We can only make sure that we handle this if everybody is on board. We had a long discussion with the tourism and hotel industries the other day. Yes, the industry is getting the brunt of it. We know. That's why we ask, though some of you in the media are all here, let's transmit the right message. But also let's transmit the real message. Because we know that there is financial losses, and the issue is not just the right message. The last comment, please don't discriminate on foreigners. I'm a foreigner, but I'm not saying because I'm a foreigner. The 2 cases in Burkina Faso are Burkina Faso nationals. The latest case in Kenya is a Kenyan. It does not discriminate. And by preventing people coming in, or by closing borders, the damage will be more in the economical senses. And that's why the ministry is selective in looking into risks and saying, from this country, we ask them to self-quarantine. And that self-quarantine is not at the expense of the government. It's at the expense of the individual. Please, let's not discriminate. Let's not stigmatize. Because that fear, that stigmatization is going to cost a lot of lives, more than the economical gains we are going to have. Thank you.
Okay, thank you. We had 1 or 2 questions from directed to the Ministry of Health.
Thank you very much. I was able to capture the concern of the ministry's ability to communicate properly. I want to emphasize that the ministry communicates through regular press releases, and we do capture what we are doing in terms of preparedness. I do not know where you read your information. I also understand that there's so much information going around. You may construe that one to be from the Ministry of Health, but please look out for signed statements by the Honorable Minister or any official of the Ministry of Health. I do believe we are doing our best, and so we don't do catastrophic communication. If there are dangers, it's better we highlight them so that people get to know. It's part of our job to communicate both the good and the bad. But also take note that these press releases, we share them with the press, and you know the press may be interested in what makes news. So that's important for you to note. It's always good for you to get exactly what comes from the Ministry of Health. Then on the issue of sensitization by Casita, thank you very much. But the issue of foreigners, the WR has talked about it. it's not about foreign. I'll surprise you, Madam, from Kasita, that you need to sensitize more. Every day I pass Kololo near the Chinese embassy. Even at this time, Ugandans are looking for visas to go to China. So you have more work to do. Let's advise, we don't ban travel. But we tell you that please, if the travel is not essential, postpone it. The same thing we said travelers from affected countries, especially category 1. We say if the travel is non-essential back to Uganda, please postpone it until the situation normalizes. Then the issue of getting to the local people, we have a strategy, and like I said, these are processes, they are not events. We have translated most of this is a process, and in due course we shall saturate this information to the local population. I think those are, let's take it. We amplify more what we are doing to protect our country so that people are encouraged to come to our country. So I look at it as good advice, and I think we shall take it. And the media should help us to amplify that.
Okay, thank you. The advice taken, and the media will help us to amplify the advice. Thank you so much for the panelists for all your presentations. We are getting to the end of this. I'm looking at the University Health Services, and we need to hear. Dr. Byamukisha is the Director of the Health Services. Only 1 minute as we move from him to Professor Ibingira to close this meeting. Dr. Byamukisha, how prepared you have 35,000 students and 4,000 staff? That is close to 40,000 people. We had 10,000 from UCU, and you are the director of the university hospital.
Thank you, moderator. Joseph and Jamisha, my names. I must say that we are getting prepared, like we have for the rest of this through the social media. We have a lot of it, including WhatsApp groups, and also we have past structures as well that are communicated to everyone. As I speak, we are also trying, some of the medical students from College of Health Sciences have also taken it up to what they are. There is a dialogue that is going to take place in a week's time, but also they have volunteered from one board of residence to another, sensitizing some of the people who may not be taking the issue very seriously. We observe that some people are not heeding to the no handshaking and not touching the faces. But also we have formed a group from College of Health Sciences that is anti-COVID-19 that can take up all the messages. So we are really handling all this very aggressively, including trying to get sanitizers and all the messages that we have discussed here and the panelists have discussed, that can we need to work closely with the other, like organizational, the professional bodies and so on, so that if a case comes up, how do we handle it? So that we have these guidelines in prevention, but also guidelines in managing the treatment. Because they usually say if you want peace, you prepare for war. If, for example, a mother is pregnant and comes in, how do you handle that mother if she's in labor? Such cases, if she's a child. So I think the guidelines, we should have the continuum from prevention to management. Thank you very much.
Okay, thank you very much. Working with the professional associations, and I'm being reminded repeatedly that we didn't answer the question of money and whether it's transmitting disease, did we? Oh, you did. Okay, it looks like it's closed then.
I can repeat it. The point for prevention is wash your hands. So with every coin you take, wash your hands. That way you can be sure that it doesn't transmit.
Okay, it looks like we know what to do with money. We love money, but it can also have some issues with it. So let's wash hands repeatedly. So please join me to appreciate once again the excellent presentations and response to comments from all our partners up front. And at this point, I would like to invite Professor Ibingira, Charles Ibingira. He's the principal of the College of Health Sciences at Makerere University. to wrap up this meeting.
Good evening, everybody. Thank you, Professor Oda, for the whole of this afternoon and evening, and also for being the brain behind this. I would like to acknowledge all protocol, and I know we are tired, but we are happy. I would like at this moment to appreciate what has been achieved by a collaboration between Makerere University through the School of Public Health and the Ministry of Health and all the agencies who are here and those who are not here, wherever they are. Thank you very much. I think we have been able to make clear the messages about this deadly disease. I think it is very clear that the disease is not here. We don't have any confirmed case. And it is important for us to go back appreciating that we are very prepared and we shall not allow this disease in our country if we all work together and follow the guidelines from the Ministry of Health. I think that is the message. Let us all be responsible. We go by the guidelines from the Ministry of Health and all the other agencies, and we protect ourselves. It is simple. Wash your hands. Don't touch your face. Don't touch your neighbor. And keep yourself safe. We also request the Ministry of Health to maintain the surveillance and monitoring so that in the case of anything, then we can do the right thing. The Ministry of Health has also told us where to run to. There is a free toll number to call. We know the hospitals to go to where we shall be quarantined in the case we have the disease, where we shall be treated. But otherwise, we should keep aware, and we appreciate that. I really don't want to say much to spoil what has been said, but I would like to appreciate each and everyone that has come. The audience has been very good. We appreciate all your questions. I think they have enriched whatever we discussed. I would like to appreciate the partners, the partners. Want also to appreciate the hotel for giving us good ambience. Please, as we go, let us not forget to keep ourselves clean by hand washing, and hand washing. So with those few words, I want to thank you so much. Professor Oda and the School of Public Health, you make Makerere University proud. Thank you very much. Have a nice evening, and let's keep safe and continue making our country prosperous. Thank you very much.
Okay, thank you so much. We appreciate all of you for coming, and for colleagues who have been patiently, listening in to us from the internet through various social media platforms. Thank you so much. We appreciate your questions as well. We've gathered all the questions. There are so many. We are going to share these questions with the Ministry of Health and with the partners, and we are going to get more answers to you all as we go along, so that we can all ably contribute to keeping Corona outside Uganda. And as you go, please remember that the elbows are not highly recommended. We've been using elbows, all of us. We are going to love people from a distance by waving and whatever it is that we appreciate. Thank you so much for joining this. Okay. Thank you so much.
Like I don't know whether.